name's Sabrina Woodleaf. I'm with the National Spine Health Foundation. I'm with Dr. Dimar from Norton Leatherman and Spine, and we are here to talk about osteoporosis.
I'm going to talk to you about osteoporosis. It's one of my favorite topics, even though I'm a surgeon. And the reason it is because it intimately affects what I do with patients surgically very directly, and can result in either successful surgery or potentially some catastrophic problems. Osteoporosis specifically refers to lower bone quality. In other words, it's not as dense, it doesn't have as much calcium, and it's a very common problem, particularly in women over the age of 50 or 60. Men actually start to get it in their 70s, and by 80s the incidence of osteoporosis in men and women is almost exactly the same. The reason why women are more prone to get osteoporosis is because they start out with less bone density from day one. And so throughout your life after the age of about 25 to 30, you lose bone and calcium out of your bone that makes it less strong. And so they get a head start. And it is certainly racially determined. For example, Afro-Americans have much more dense bone, so they're less likely to get osteoporosis as they get older because they start with more dense bone. So you lose less as you get older. You can only add calcium to your skeleton until you're about 25 to 30 years old, and then you lose it throughout your life. And women in particular, when they get to be about 50 and go through menopause, they'll lose 4% of their bone mass, or essentially how strong your bone is, over about a 5-year period. So you can see over a relatively brief period of time, 4 or 5 years, you can lose 20% of your bone strength and bone density, so to speak.
For that small window of time that you are able to add to your bone health, what do you recommend to patients?
Well, most of those patients, fortunately, between age 18 and 30, I generally won't have to operate on them. But I always tell mothers to tell their daughters that, particularly during childbearing ages where you lose calcium again, you may not have good dietary intake, and particularly vitamin D, which is crucial to your bone health, you may not be taking enough of that. I always recommend that they have supplements because many Americans, because they work indoors, don't get sunlight to make their own vitamin D, and particularly in the winter months in the northern latitudes, almost everybody I check will have a deficient vitamin D level, and it is crucial that the vitamin D be normal or you won't absorb calcium from your intestine, and essentially you'll end up developing very calcium deficiency, so to speak.
So that's something that you obviously test for and try to manage preoperatively.
Absolutely. I always test for vitamin D. Calcium levels are very tightly maintained, and if they get out of whack, you've probably got some very other serious problem going on. But most of the patients I see will have deficient vitamin D. Like Dr. Joe Lane, who is kind of a mentor of mine, taught me a long time ago that we checked my partners, everybody checked their vitamin Ds, and we all were deficient. And so certainly from an orthopedic surgeon standpoint, everybody in my office as a surgeon has taken vitamin D for the last decade, if that's any testimonial why it's so important.
I think it is, absolutely. What other points do you want to make sure that your patients leave the office knowing about their bone health?
Well, I think once you get to be 50 as a woman, you almost certainly should have a DEXA scan to check your bone density. It is amazing how many people just don't think about that, and how many primary care doctors fail to put that in their routine screening. You have to realize that white females, Northern European descent, and particularly smokers, have an incredibly high incidence of early osteoporosis. And traditionally, a lot of women would have hysterectomies, and they would also take their ovaries. That's another huge risk factor, and some of the times that would occur in the 30s and 40s. And so by the time they get into their early 50s, they already have significant osteoporosis. So those are some of the risk factors. And another risk factor, of course, as I alluded to, is genetics. We now know that there's certain genetic defects of the collagen genes that actually are associated with early osteoporosis, and there's some sort of defect in that will lead you to have it earlier. So it is genetically based also.